This is Ron. He has recently been diagnosed with lung cancer. This can be due to many different factors, including smoking, which causes the majority of lung cancers, as well as a number of environmental risk factors have been identified, most of which relates to occupational exposures such as asbestos, tar, soot, and a number of metals such as arsenic, chromium, and nickel. Also, there is an increased risk of lung cancer among first-degree relatives, indicating a genetic susceptibility. Lung cancer affects the homeostasis of the body, as normally cells divide at a rate to replace old cells and to maintain homeostasis. This is controlled by the cell's DNA, but when the DNA becomes mutilated, like with cancer cells, it can cause these cells to divide uncontrollably. A cell will start to divide uncontrollably and form a mass of uncontrolled cells called a tumor.
In the body is called metastasis. This can happen in several ways, including local invasion, where cancer cells invade nearby normal tissue; intravasation, where cancer cells invade and move through the walls of nearby lymph vessels or blood vessels; and circulation, which cancer cells move through the lymphatic system and the bloodstream to other parts of the body.
About 95% of primary lung cancers are carcinomas that arise from lung tissue. The other 5% is a miscellaneous group including bronchial carcinoid tumors, bronchial gland tumors, fibrosarcomas, and lymphoma. Aggressively, locally invasive, and widely metastatic tumors that come from epithelial lining of major bronchi. These tumors start as small mucosal lesions that follow several different patterns of growth. They can form intralumni masses that invade bronchial mucosa and infiltrate parabronchial connective tissue, or they can form large bulky masses extending to adjacent lung tissue. Proteins called barchiuri plays a role in initiating the growth and spread of cancer cells. They are found in the lung cancer tumors. They also play a role in cancer drug resistance. 4 major categories of lung cancer include squamous cell lung carcinoma, adenocarcinoma, small cell carcinoma, and large cell carcinoma. The small cell lung cancers affect neuroendocrine cells characterized by a certain cell type, small round to oval cells that are approximately the same size as a lymphocyte. These cells grow in clusters and don't exhibit glandular or squamous organization. Since some of these tumors can secrete polypeptide hormones and have some neuroendocrine markers present, it is suggested that these tumors may arise from neuroendocrine cells from the bronchial epithelium. This cells type has the strongest link with cigarette smoking and is rarely observed in someone who has not smoked.
Non-small lung cancers affect epithelial cells and include squamous cell carcinoma, adenocarcinoma, and large cell carcinoma.
Symptoms of lung cancer include cough, which is caused by the presence of a mass that irritates the cough receptors in the airway. It's most common in squamous cell carcinoma and small cell lung cancer, most commonly found in the central airways. Weight loss. Cancer-induced lipolysis and proteolysis leads to loss of adipose tissue as well as skeletal muscle. Protein synthesis is also reduced via a number of mechanisms. Dyspnea is caused by extrinsic or intraluminal airway obstruction, or activation of mechanoreceptors and chemoreceptors in lungs due to cachexia or acidosis. Hemoptysis, or coughing up blood, is caused by a tumor in the central airway. Blood vessels there, resulting from the tumor-induced angiogenesis, are leaky and tortuous, predisposing them to easy rupture, causing hemoptysis.
Treatment for lung cancer is typically guided by stage. Treatments include chemotherapy, radiation, and surgical removal. Complete surgical removal is the best treatment, but is only possible in patients with early-stage disease. Chemotherapy is beneficial at most stages of disease, although it and radiation therapy are curative in only a minority of patients.
With drug therapy, MRP1 proteins transport cancer drugs out of the cell membrane, which reduces the concentration at intracellular targets, so acting as a transport protein. The medications go in through the cell membrane, attached on by the MRP1 proteins, which carry them out of the cell. In Ron's case, his cancer was detected early enough that successful surgical removal was done, and he is now in recovery.